Hello again, and once again, welcome to the Compass One Healthcare Podcast Studio at the Vizient Connections Summit here at the Wynn Hotel. And we're going to be talking about, just for nurses, support service strategies that drive nurse engagement. Supporting clinical caregivers is an essential part of providing a great patient experience. And we are going to discuss how service line collaboration can help nurses and positively impact the quality of care. And as mentioned, there's no two better ladies in the industry to talk about that. First to my left here is Aundrea Mills. She's the Chief Nursing Officer for Compass One Healthcare. And next to her is Sophia McCrae, the VP of Operational Strategy for Compass One. Help us understand how we got here and how are the nurses? I mean, it's always such a buzzword in the industry, but nurses and the stress they face day to day.
It's so real. First, before I start about that, let's talk about the fact that, at Compass One, we recognize that our nurse partners are so important.
Yeah.
And being one team is so important. We know they can't do it alone.
Right.
So there's so much to unpack about what's going on right now. The profession is both stretched and full of possibility. How the systems respond to the nurses' needs will determine whether the field tips toward the sustained crisis or meaningful transformation. And I think that's where we come in, the transformation.
Sophia, what are you seeing from your angle as far as just the stress that's on the nurses, but how Compass One is really stepping up to address it and say, we know you got issues, we're here to help?
Oh, absolutely. And I know in 2019, and I know we've talked through this, we strategically entered into a relationship with the ANA to understand highlights, pain points, stressors, so we can embed those opportunities into the culture of our department so we can really serve as a leading hand. But man, when we met Aundrea and her team came on board, I mean, the possibilities for collaboration and connected care are endless. We understand the varying different licenses that nurses can accomplish. We understand what they're going through, how on average they spend 1 to 4 hours on non-clinical tasks. And her team really allows us to operationalize those findings so we can make meaningful change and celebrate the wins together alongside our nursing partners.
So Aundrea, there's obviously a need there. But as a support service provider, where do we even start? It's just such a big need.
Yeah, where do we start? So obviously we have to hear from them. We have to hear from them because each hospital has their own unique culture.
Right.
But the ability to journey map their experiences, to hear from them through surveys, and then apply what we're hearing into our operational workflows, those non-clinical tasks. So I think that's definitely where we start. But we can't just focus on that. We have to understand the impact of wellness on their work days. And we understand that. And through our dynamic food network and who we are, we have the opportunity to make sure that we're looking at their nutrition 24/7.
Okay.
And we'll unpack that a little bit later in just a minute. But I think that's it. That's hearing from them, optimizing the workflow at top of license so they're not doing those non-clinical tasks. And then, of course, prioritizing their wellness.
Sophia, your focus is more on the operational process of everything and the organizational strategy. What is your role of strategic support services like at Compass One and the environment like this?
Well, it really comes down to, as Aundrea mentioned, understanding our partners, what's most important to them, what will keep our partnership engaging and effective, ensuring that, of course, they can remain at top of license. But we take the findings from her team from a survey perspective and embed that into the operation. So you can imagine entering a partnership where we're mission aligned and taking the nurses' feedback and ensuring we're delivering on what we promised to them. Something as simple as effective communication and collaboration by over-communicating, by participating in nurse leader rounds, by joining orientation just so that they could understand our processes is taking us to another level. Even from a training perspective, we have so many simulation labs across the country. When we think about maximizing patient throughput, we're bringing the nurse, the patient aide, the housekeeper, the food and nutrition worker into a room and actually doing simulation training on cross-collaboration. So again, we could positively impact throughput and drive satisfaction around teamwork and so satisfaction essentially.
Yeah. Sophia, let's ask for a few examples of how your teams have partnered with nurses to help patient experience and patient safety. You have some examples from the field?
Oh, yeah. And I know this may seem pretty scary to state, but healthcare associated infections continue to be US healthcare's $40 billion problem.
Right.
That number is growing. So we serve truly as an extension of clinical teams in infection prevention. We partner on using the right products, the right way, the right time. So we're monitoring those outcomes, and those interventions that we work so hard alongside clinical teams to accomplish are in our culture of our departments. It's everything from how we use agile technology, the clinical teams rolling out something as simple as a wearable hand hygiene monitoring system. I mean, we're in the fight toward minimizing the spread of bioburden and HAIs together. And I think that foundation is where it starts. We want to, again, use the right products the right way, and then celebrate the wins, whether it's a unit social for achieving HCAHPS outcomes or focusing on our high reliability approach and journey so that if someone's caught in the act, whether it's preventing a spill, double checking a tray, or even from a transport perspective, safely verifying that they're going from point A to point B, those are opportunities that lead to zero harm. And when we call them out, it's a really, really big deal for our operators and our clients alike.
You've also had some recent successes on the food and nutrition side. What's your team seeing there?
So, as she mentioned, the workflow, as we evaluate the nurses' needs in regards to meals and food nutrition, first and foremost, we want to find out what are those pain points that maybe they're taking on non-clinical tasks. Okay. So we're seeing success in that. We ask them, in many of our health systems, we've surveyed the nurses Sophia touched on, and they told us. And so who would have thought that making sure that we have processes to remove the soiled tray pickup so that it's not one more thing the nurse has to do. Who would have thought that the nourishment rooms, prioritizing the nourishment room process is so important to the nurse, especially after hours. And then, of course, 24/7 nutrition after hours. There's some things that we're listening to the nurses and we're applying. But what I can tell you is one of our large health systems in Charleston, we saw significant improvement in just a 6-month study, 17% nurse satisfaction improvement with the meals process in just 6 months.
17%. That's a huge number.
I remember as a chief nurse in the hospital, we used to say, okay, if we can improve year over year 2 to 4%, we're really doing good. That's hard to do. To move that needle is so hard to do. But we did it. And so what did we learn from that? Thousands of nurses. So now we have trends, and we talk about scaling those lessons learned that we know are satisfiers to the nurses all the way across the country. So that's one of the successes. But from a nutrition standpoint, near and dear to my heart is because I did work night shift and weekends. So making sure that we are hearing from the nurses who they work after hours and weekends, we have a great success coming out of our partners at Centaur. They actually named their room. They have a nutrition room now, and Breakaway Bay, they call it. And that's what they wanted. They wanted nutrition 24/7. But not only do we have nutrition in there, they actually got to be a part of what's in that space. Partnering with the American Nurse Association, Healthy Nurse, Healthy Nation, hearing from the nurses and applying what they need in a space that is accessible 24/7. So great success around that model. It just goes to show that when we operationalize the voice, we're bringing back to the clinicians nutrition and needs and satisfaction in their workplace.
Speaking on that level, what are you guys both hearing from the field when it comes to nurses and hospital leaders about these results that you're starting to see?
I mean, first and foremost, the gratitude that we have nurses on our team that understand the nurse language. I hear that overwhelmingly. It's not that we know everything. We just know their language. We've worked in the field. My team, 30-year experienced nurses, we know the challenges. But the gratitude is overwhelming that our company cared enough to bring our expertise into the field.
Absolutely. And I think it's true partnership and a shared mission toward collaborative, connected care. For our service lines, we could be in the room anywhere from 7 to 21 times a day. So to serve as the first line of defense, God forbid if someone's coding, we're there to support clinical teams. If there's a mishap or a spill, we're right there alongside them. It's preventing the harm that we're trying to accomplish from a high reliability perspective. And then, of course, being on the journey alongside those that we care for in a meaningful way.
And how do we apply this back to supporting our partners from a nurse retention standpoint?
Right.
Really
This is a
important.
big thing.
So think about the numbers. If you may not be aware, but just one nurse that leaves, resigns, and to replace that nurse, anywhere from $55 to up into $80,000 annually for one nurse that leaves.
Wow.
Yes, that's overwhelming.
So,
When you see turnover rates that are so high now because of the burnout and the resiliency that's required in the environment that is so complex now. So what we're doing is we're supporting those nurses. We're supporting our partners in the field with nurse retention by nurse satisfaction.
in the future, what do you guys see? Like, how are we going to continue to support these nurses, both professionally and personally? Because, like you said, they're so vital to the success of the hospital, to the health of the patients. And turnover is a problem, and shortage of nursing is a problem. So how do you guys see the future, both professionally and personally, for these nurses?
I'll start, Sophia. I think first and foremost, staying in front of the data, leveraging our partnerships with Prescani and the American Nurse Association, making sure that we're staying in front of the trends as to what the nurses need. And then, of course, our partnerships with our teams. My nursing team, we partner with the patient experience team, the patient solutions team, all across the country to say, not only are we focusing on the patient experience, but the clinician experience is equally as important too.
Yeah.
It's fantastic. And I think it comes down to what's mission critical, and it's that we're here to save lives and impact patient safety. And saying that to a wonderful nurse in itself, it shows that we're aligned with the joint mission. It's about ensuring that we're recognizing them along the way. At the end of the day, we have to care for those that care for patients the best, and those are our nurses. So celebrating them along the way and leveraging Aundrea and her fantastic team to help us kind of gather the insights to help make smart decisions. And then I think we'll be on a great trajectory in the future.
Well, I know I speak for everybody at Compass One Healthcare, but thank you both for all the work you're doing with the nurses and supporting them. And like you said, multiple times in this conversation, communicating with them, hearing their voice, and then reacting to that as well. That's awesome. So thank you so much for joining us here on this podcast. Great discussion. And I hope you have a wonderful rest of your summit.
Thank you.
You're welcome. Thanks.